Trying to lower your cholesterol, but not sure how Zetia fits in? In this video, we'll break down how to use Zetia Ezetimibe, how it works, and what you need to watch for in under 5 minutes. How to use Zetia Ezetimibe, uses, dosage, and key information. What is Zetia Ezetimibe? Zetia, also known by its generic name Ezetimibe, is an oral medication prescribed to manage high cholesterol levels. It works by lowering total cholesterol and low-density lipoprotein LDL, commonly referred to as bad cholesterol, in the bloodstream. Zetia is often used in combination with statins or as a standalone therapy when statins are not well tolerated. While generally well tolerated, its effectiveness is maximized when paired with a healthy diet and regular physical activity. What is Zetia Ezetimibe used for? Zetia is primarily used to treat high cholesterol, especially in individuals who are unable to reach their target cholesterol levels through lifestyle changes alone. It may be prescribed for individuals with primary hyperlipidemia, patients with familial hypercholesterolemia, those requiring adjunct therapy to statins or unable to tolerate statins. How does Zetia Ezetimibe work? Zetia belongs to a class of drugs known as cholesterol absorption inhibitors. It works by reducing the absorption of cholesterol in the small intestine. Unlike statins, which decrease cholesterol production in the liver, Ezetimibe directly targets the digestive system, lowering the amount of LDL cholesterol entering the bloodstream from food. Zetia Ezetimibe, dosage forms and pricing. Zetia is available in tablet form, typically as a 10 milligrams dose. Dosage, quantity, average price with coupon, price per unit, 10 milligrams, 90 tablets, $14.40. with GoodRx coupon, $0.16/tablet. Note, without a discount, the average retail cost is approximately $322.97. Always check for savings programs or pharmacy coupons to reduce out-of-pocket costs. Typical Zetia Ezetimibe dosage. The standard dosage is 10 milligrams taken once daily, with or without food. It's important to follow your healthcare provider's instructions closely and avoid skipping doses. Zetia is often taken at the same time each day for consistency. What are the side effects of Zetia Ezetimibe? While Zetia Ezetimibe is generally well tolerated, some individuals may experience side effects. Most side effects are mild and tend to improve as the body adjusts to the medication. However, you should contact your healthcare provider if symptoms persist or worsen over time. Common side effects. These occur in a small percentage of users and are typically manageable. Upper respiratory tract infection, reported in approximately 4% of patients. Diarrhea, 4%. Joint pain, arthralgia, 3%. Sinus inflammation, sinusitis, 3%. Pain in arms or legs, extremity pain, 3%. Other reported side effects. These are less common but may still occur. Rash, fatigue, or tiredness. Headache, dizziness. When to contact your doctor. Although rare, serious reactions may occur. Seek medical advice immediately if you notice signs of an allergic reaction, such as rash, itching or swelling, unexplained muscle pain, or unusual fatigue. These could indicate more serious conditions, especially when Zetia is used in combination with statins. Pharmacist tips for taking Zetia Ezetimibe to ensure the best results and reduce the risk of complications. Follow these pharmacist-recommended guidelines when taking Zetia Ezetimibe. 1. Take Zetia consistently. Zetia can be taken with or without food, but it's important to take it at the same time each day to maintain a steady level in your body. Consistency improves treatment effectiveness and minimizes missed doses. 2. Watch for drug interactions. Zetia interacts with a number of other medications. Before starting Zetia, inform your healthcare provider about all prescription drugs, over-the-counter medications, and supplements you're taking. Continue to keep your provider updated throughout your treatment. 3. Timing with bile acid sequestrants. If you're also taking a bile acid sequestrant, such as cholestyramine Prevolite, Cosevalum Welchol, take Zetia at least 2 hours before or 4 hours after these medications. Taking them too closely together can interfere with Zetia's absorption, reducing its effectiveness. 4. Maintain lifestyle modifications. Zetia is most effective when used in combination with lifestyle changes. Continue to follow a low-fat, heart-healthy diet and maintain a regular exercise routine during treatment. Medication alone is often not enough to manage cholesterol levels optimally. 5. Missed dose guidance. If you miss a dose, take it as soon as you remember. However, if it's close to the time of your next scheduled dose, skip the missed dose and resume your regular dosing schedule. Do not double up on doses to make up for the missed one. 6. Routine monitoring is essential. Your provider will order periodic blood tests to monitor your cholesterol levels and assess your response to the medication. This helps ensure that Zetia is working effectively and allows for timely adjustments if needed. Is Zetia Ezetimibe a first-choice medication for high cholesterol? No, Zetia is not typically the first-line treatment for high cholesterol. According to the 2018 Cholesterol Treatment Guidelines, statins remain the preferred initial therapy. However, Zetia is often added when further LDL reduction is needed or if statins are not tolerated. It lowers LDL cholesterol by approximately 13% to 20% with minimal side effects, making it a valuable second-line or adjunct therapy. Always consult your healthcare provider about the best treatment strategy for your specific condition. How long does Zetia Ezetimibe take to work? Zetia typically reaches full cholesterol-lowering effect within 2 weeks of starting treatment. Since it does not produce a noticeable physical sensation, the effectiveness is monitored through routine blood tests. It's important to attend follow-up appointments to evaluate your progress. What's the best time of day to take Zetia? Zetia is a long-acting medication, so it can be taken at any time of day, with or without food. For best results, take it at the same time every day. If you're also on a statin or fenofibrate, these can be taken together with Zetia. Does Zetia cause muscle pain like statins? Zetia, when taken alone, appears to have a lower risk of muscle-related side effects compared to statins. However, some patients have reported muscle pain when using Zetia in combination with a statin. While uncommon, muscle pain cannot be completely ruled out. Contact your healthcare provider if you experience any unexplained muscle discomfort. Can I take Zetia while pregnant? The safety of Zetia during pregnancy has not been well established. If you're also taking a statin, use of effective birth control is recommended, as statins are not considered safe during pregnancy. If you're pregnant or planning to become pregnant, discuss all treatment options with your healthcare provider to ensure safety for both you and your baby. Stay informed with HeInfo. Want reliable, easy-to-understand explanations about medications and health conditions? Subscribe to HeInfo for more pharmacist-approved insights. Like and share this video if it helped you. Drop your questions or experiences in the comments. We read every one. Explore our channel for in-depth guides on medication side effects and safe usage. Empowering your health, one video at a time.